Anxiety disorders. Anxiety refers to uneasy, fearful feeling of apprehension, which means fear, over an anticipated problem. Anxiety can be reduced by indulging into defensive actions. Symptoms of anxiety interfere with important areas of function or cause distress in the person. These symptoms are not caused by drugs or medical condition. These are marked fears which are consistently triggered by specific objects. These symptoms persist for at least 6 months. Types of anxiety disorders. The first one is phobias. Phobias are irrational fears as potential hazard is not there. It is intense and persistent. Phobias can be powerful only when it changes the person's life in a major way. Examples of phobias. The first one is agoraphobia, where there is fear of wide open spaces or crowds. Second one is claustrophobia, where there is fear of small closed spaces. Causes of phobia. According to the learning theories, phobias are learned by pairing. That is, phobias are seen as a conditioned response that follows after a threatening incident and is sustained by avoidance. For example, in the mind of a child, if a toy is paired by a large sound effect and if both occur simultaneously, this will result in phobia of the toy. Other causes. Phobias are also learned by modeling or imitation. Agoraphobia is brought about by negative thoughts about the consequence of experiencing anxiety in public. The second type of anxiety disorder is panic attacks or panic disorders. Panic disorder is displayed in terms of panic attacks. These occur for a specific period of time, which includes intense apprehension or fear. Types of panic disorders. We have cued panic disorders and uncued panic disorders. Cued panic disorder is triggered by specific situations, and uncued panic disorder is not triggered by specific situations. Cause of panic disorders is when there is increased level of neurotransmitter which triggers the sympathetic nervous system. Symptoms of panic disorders include nausea, dizziness, light headaches, stomach upsets, chest pain, trembling, fear of dying, depersonalization, where there is feeling of being outside one's body. Management of panic attacks or panic disorders include behavior therapy and systematic desensitization. The third type is generalized anxiety disorder. The main feature is excessive worrying, that is, they keep on thinking about the problem. Worry can either be effective or it can be ineffective. Worry is a cognitive tendency to think about a problem and be unable to get over it. Worry is excessive, uncontrollable, and long lasting. People tend to worry about various issues, for example, financial, family problems, etc. The fourth type of anxiety disorder is post traumatic stress disorder or PTSD. PTSD is experienced by a person only when the person has experienced a traumatic event, for example, a serious injury, or sexual violation, or death, etc. PTSD is grouped into four categories. The first one is intrusively re experiencing the traumatic event, where the person may have repetitive memories or nightmares about the battlefield or darkness that reminds them again and again. The second one is avoidance of stimuli associated with the event, wherein people try to avoid the reminders of the event. The third one is mood and cognitive changes after trauma. The person experiences negative cognition, blaming oneself for the incident, negative emotions, lack of interest, and detached feelings. The fourth one is symptoms of increased arousal and reactivity, which includes irritability, self destruction, difficulty in concentration, and difficulty in sleeping. Criteria for diagnosing PTSD: at least one of the following intrusion symptoms must be seen. That is, recurrent dreams related to the event or recurrent involuntary distressing memories of the trauma. Second criteria: at least one of the avoidance symptoms should be seen, that is, avoidance of internal reminders of trauma or avoidance of external reminders of trauma. Third criteria: at least three negative alterations in the mood, that is, inability to remember important part of the trauma, feeling of detachment from others, and inability to experience positive emotions. Fourth criteria is at least three alterations in arousal and reactivity should be seen. That can be sleep disturbance, irritable behavior, or problems in concentration. Causes of PTSD: the severity of trauma influences whether a person will develop PTSD or not. People who have symptoms of dissociation, that is, removed from one's body, after the trauma are more likely to develop PTSD. Management of PTSD includes systematic desensitization, that is, by working on less intense to most intense fears, hence, to extinguish the fear response. Second, we have imaginal exposure, deliberately making the person remember the event. And the third one is virtual reality. Fifth anxiety disorder is obsessive compulsive disorder. Obsessions are intrusive recurring thoughts, images, impulses that are uncontrollable and persistent and appears to be irrational. That is, the person cannot stop thinking. These obsessions have force and frequency that interferes with normal activities. Example: fear of contamination, body problems, sexual impulses, etc. These individuals are more prone to doubts and procrastination. Compulsions are repetitive behaviors or mental acts that the person feels driven to perform to reduce anxiety. Even though rationally there is no need for this behavior, the person feels as though something ill will happen if the act is not performed. Some compulsions include washing hands over and over again, counting or touching the body parts repetitively, checking that stoves, burners, windows, and doors are locked. Compulsive gamblers, compulsive eaters, and compulsive drinkers are not considered under OCD because it provides them pleasure. Causes of OCD: three closely related areas of the brain are said to be active in OCD people, that is, the orbitofrontal cortex, the caudate nucleus, which is a part of the thalamus, and the anterior cingulate cortex. OCD can also be genetically transmitted. Reinforcement by models. For example, compulsive hand washing will provide relief from obsession about germs. This is another cause. Management of OCD. Medications, for example, serotonin, which is an antidepressant drug. Exposure and response prevention, that is, exposing the individual to anxiety source without intention of causing damage or danger and thus overcoming anxiety.